Hey there, health enthusiasts. In today's video, we're diving deep into the world of weight loss supplements. We'll be exploring the most common ingredients found in these products, examining the scientific evidence behind their effectiveness, and discussing potential risks and safety concerns. By the end of this video, you'll have a comprehensive understanding of the role supplements can play in your weight loss journey and be equipped to make informed decisions about their use. So, let's get started. Weight loss is a hot topic for many Australians, with over 2/3 of adults classified as overweight or obese, according to a 2020 report by the Australian Institute of Health and Welfare. It's no surprise that people are turning to dietary supplements for extra support, with a recent Roy Morgan survey revealing that 24% of Australians have used at least one weight loss product in the past year. However, the effectiveness and safety of many of these supplements remain questionable. The global weight loss supplement market is booming, expected to reach a whopping $33.4 billion by 2027, as reported by Grandview Research in 2020. But the Therapeutic Goods Administration, or TGA, here in Australia has raised concerns about the quality and safety of some of these products. Many contain undeclared or banned substances that can cause serious adverse effects. Furthermore, most supplements lack high-quality evidence from randomized controlled trials to support their efficacy for weight loss. So let's take a closer look at some of the most common ingredients found in weight loss supplements, starting with caffeine. Caffeine is a popular stimulant that's believed to boost metabolism and increase fat burning. A 2019 meta-analysis by Tabrizi and colleagues found that caffeine intake was associated with significant reductions in weight, BMI, and body fat compared to placebo. However, the long-term efficacy and safety of caffeine for weight management are still uncertain, and excessive consumption can lead to side effects like insomnia, anxiety, and digestive issues. Next up, we have green tea extract, which contains caffeine and polyphenols called catechins. A 2011 meta-analysis by Herschel and colleagues found that catechin-caffeine mixtures from green tea led to a small but significant increase in energy expenditure and fat oxidation compared to placebo. However, the weight loss effects were modest, with an average difference of just 1.31 kilograms over 12 weeks. While green tea extract appears to be better tolerated than some other stimulant-based supplements, there have been rare cases of liver toxicity associated with high doses. Garcinia cambogia is another popular ingredient, containing hydroxycitric acid, or HCA, which is claimed to inhibit fat synthesis and suppress appetite. However, the evidence for its efficacy is mixed. A 2011 meta-analysis by Onakpoya and colleagues found that Garcinia cambogia extract produced small, short-term weight loss compared to placebo, but the clinical relevance of this modest effect is uncertain. There are also concerns about the safety of Garcinia cambogia, with animal studies suggesting it may cause testicular toxicity and human case reports linking it to liver damage. Glucomannan, a soluble dietary fiber from the konjac plant, is often promoted as an appetite suppressant. While a 2015 meta-analysis by Zalewski and colleagues found that glucomannan supplementation led to a small reduction in body weight compared to placebo, more research is needed to establish its long-term efficacy and safety. Glucomannan is generally well tolerated but can cause gastrointestinal side effects and, in rare cases, esophageal or intestinal obstruction. Finally, let's talk about chromium, an essential trace mineral claimed to enhance insulin sensitivity and reduce body fat. However, a 2013 meta-analysis by Onakpoya and colleagues found that chromium supplementation resulted in only a small reduction in body weight compared to placebo, with uncertain clinical significance. High doses of chromium have also been associated with kidney damage and interactions with medications in some case reports. Despite the popularity of weight loss supplements, their overall efficacy remains questionable. Most of the ingredients we've discussed have shown only modest, short-term weight loss effects in meta-analyses, with mean differences ranging from 0.39 to 1.31 kilograms compared to placebo. The methodological quality of many trials is also poor, with small sample sizes, short durations, and high dropout rates limiting the reliability and generalizability of their findings. It's important to remember that weight loss supplements are not a magic bullet for obesity management. They should be used as an adjunct to a balanced diet, regular physical activity, and other lifestyle modifications, not relied upon as the sole strategy. The most effective and sustainable approach to weight management focuses on gradual, long-term changes to dietary and physical activity habits, as emphasized by the National Health and Medical Research Council. Safety is a major concern with weight loss supplements, as they are not as strictly regulated as pharmaceutical drugs in Australia. The TGA regulates most weight loss products as complementary medicines through the Listed Medicines Scheme, which means they are not subject to the same rigorous pre-market evaluation as registered medicines. As a result, weight loss supplements may contain undeclared, untested, or banned ingredients that can cause serious adverse effects. Even supplements containing legal ingredients can cause side effects, particularly when taken in high doses or combined with other substances. Common adverse effects include gastrointestinal symptoms, headaches, insomnia, anxiety, palpitations, and raised blood pressure. More serious events like liver toxicity, kidney failure, and cardiovascular complications have also been reported in association with certain ingredients. Certain population groups may be at higher risk of adverse effects from weight loss supplements. Pregnant and breastfeeding women should avoid these products due to the lack of safety data and potential harm to the fetus or infant. Children, adolescents, and people with pre-existing health conditions like hypertension, arrhythmias, and liver or kidney dysfunction should also exercise caution. So what can you do as a consumer to make informed decisions about weight loss supplements? First and foremost, consult a healthcare professional before starting any supplement to discuss its potential benefits and risks and ensure it's appropriate for your individual health status and goals. Be wary of exaggerated claims promising rapid or effortless weight loss, and check for TGA approval and third-party certification to ensure the product has been assessed for safety and quality. Always read the label carefully, check the ingredient list and serving size, and be aware of any potential allergens or interactions with medications. Follow the recommended dosage instructions and don't exceed the stated dose without consulting a healthcare professional. If you experience any negative side effects, stop using the supplement immediately and report your reaction to the TGA through their online adverse event reporting system. Remember, supplements are not a substitute for a healthy diet and regular physical activity. Sustainable weight loss is best achieved through a combination of reduced energy intake, increased energy expenditure, and behavior modification. In conclusion, while some weight loss supplements may offer modest short-term benefits, their overall efficacy and safety remain questionable. As a consumer, approach these products with caution and prioritize lifestyle changes as the foundation of your weight management strategy. If you do choose to use supplements, select them carefully, use them under medical supervision, and integrate them into a comprehensive, evidence-based approach to obesity prevention and treatment. That's all for today's deep dive into weight loss supplements. If you found this information helpful, be sure to hit that like button and subscribe to our channel for more evidence-based health and nutrition content. And if you're looking for high-quality supplements and personalized nutrition advice, head over to nutritionmarket.com.au. We have a virtual clinic with clinical nutritionists and naturopaths serving clients in Australia and around the world, so book a consultation today. As always, remember that this video is for informational purposes only and should not be considered medical advice. Consult with your healthcare provider before making any changes to your diet, exercise routine, or supplement regimen. Thanks for watching, and we'll see you next time.